In this video, going to discuss regarding the pyogenic meningitis. Pyogenic meningitis. Already we have discussed a lot of things regarding the bacterial meningitis. So it is also a bacterial meningitis. So this is also known as suppurative or bacterial meningitis. Bacterial meningitis. So regarding this, like that the organism which produce pus forming, known as pus forming. This organism form pus of the pyogenic bacteria. So moving on the definition regarding pyogenic meningitis. So pyogenic meningitis means it is refer to the like acute inflammation of meninges, leptomeninges, meninges, and that caused by the bacterial infection, bacterial infection, and characterized by it's characterized by neutrophilic purulent CSF response. It means there is the high protein and low glucose level. So this is regarding pyogenic. So we have already discussed regarding as the age group regarding the in the previous video, like regarding the age neonate, infant, child, elderly, immunocompromised, or the post-natal surgery, like which organism causing this this type of the infection. So we have already discussed. So I am not going to again discuss this thing. So I am going to discuss regarding the detailed profile of organism. Detailed of the organism, like we have already noted the organism is Streptococcus pneumoniae. Regarding Streptococcus pneumoniae, we are going to discuss what are the like first we discuss morphology, then we discuss virulence factor, then we discuss culture, then we discuss reactions, Quilling reactions. Regarding this organism, there is a Quilling reaction, and then where is the common, which age group is the common, or which type of patient is common in, and then we discuss vaccine available or not, so vaccine available. So these topics are the highlighted topics. So we discuss every organism and based on these topics. So regarding morphology, so when we look at the morphology, it's a gram positive lancet shaped. In previous video briefly I have discussed this diplococci, and encapsulated, is presence of encapsulated organism. So these are the morphology. It's gram positive lancet diplococci and encapsulated. When look at the virulence factor of this Streptococcus pneumoniae has capsule, is the main capsule. So it is anti-phagocytic, and there is pneumolysine. These are the valence factor. Others, there are lots of the valence factor. So I am not going to discuss. I am going to highlight it point discuss. So when we look at the culture, so based on the culture, it is alpha hemolytic on blood agar, and its biological test approaching sensitive. And when we look at the cooling reaction, it's so cooling reaction positive. So there is capsule swelling occur. Common in the children of the age less than 5 years, and sometime in elderly. So when discussing regarding the vaccine, yes, vaccine is available. The vaccine name is pneumococcal vaccine. This is regarding the Streptococcus pneumoniae. Now moving on the another organism which causes the pathogenic infection. So the another one is Neisseria meningitidis, and this is known as meningococcus. So again we have discussed regarding some points. So like there is morphology of this organism, then there is virulence factor, then there is culture, then we discuss some syndrome. In here is present of some syndrome, so we discuss also some syndrome. Then we discuss transmission, some syndrome or key syndrome, and there is the vaccine. Regarding vaccine available or not, vaccine availability available. Then regarding the prophylaxis of this infection, what are the drugs used. So moving on the morphology, when we look this organism, it is a gram negative kidney shaped diplococci. And when we look at this virulence factor, there is capsule, then there is endotoxin, then there is IgA proteases. So in the capsule there is just 13 serotype of this serotype. So there is A, B, C, Y and W135. W135 are the common, and 13. Then endotoxin, there is the LPS. So its causes shock. This is a type of endotoxin which causes shock. IgA proteases. When we look at the culture, there is in the culture chocolate agar. We can use chocolate agar and it's grow in the 5 to 10% of CO2. It present 5 to 10% of CO2 carbon monoxide. It's grow in this environment. And when we look at some key syndromes, like there is Waterhouse Friderichsen like there is a damage of this infection caused the, like there is a adrenal gland or infection or damage of adrenal gland. This is known as by due to the infection of this organism, so that is known as Waterhouse Friderichsen. When you look at transmission, there is is transmitted through the respiratory droplets. And regarding the vaccine, as its vaccine is applicable, vaccine name is meningitidis, what the name, and B vaccine. And regarding the prophylaxis, we can use rifampicin, ciprofloxacin if the patient is got rifampicin. For the prophylaxis, we can rifampicin, ciprofloxacin if the patient in the for contact. Then there is another organism known as Haemophilus influenzae. The third one is Haemophilus influenzae. This is type B. So Haemophilus influenzae type B is causing the pathogenic or bacterial infection. So when we discuss regarding morphology, its morphology is like this is a gram negative. Coccobacillus, and when you look, it is encapsulated type B. Type B is the virulent. When you look the virulence factor of this organism, so virulence factors are PRP, and as polyribosyl ribitol phosphate capsule. And another one is the IgA protease. Then when discussed regarding the growth requirement, so for this development of this organism need to the factor 10 and factor 5 growth development or growth requirement. It needed to the factor X known as hemin, and there is factor 5 NAD needed, factors needed for the growth. Moving on, the which culture or agar is used for this organism. So in the agar there is use of the chocolate agar, not use the blood agar due to these factors, not used blood agar due to the lack of the factors. So when we look at the affected, which type of common in, so it's common in infant and child due to the immune children of less than 5 years. And regarding the vaccine, it has a vaccine name is the HIV Haemophilus influenzae B type vaccine. This is a conjugate type of vaccine. So moving on the another organism. This organism name is Group B Streptococcus known as Streptococcus agalactica. Streptococcus agalactica. So regarding this organism, moving on the morphology of Streptococcus agalactica. So in the morphology, it is a gram positive cocci in chain, and it's so beta hemolytic, and when we look for the reservoir, so reservoir this is mainly found in the vaginal flora of mother. And transmission during the childbirth is transmission during childbirth. And when you look at the culture of this Streptococcus B, so in the culture we look in the blood agar. We can use blood agar and its culture in the blood agar. So there is a prevention, we can prevent by the intrapartum antibiotic to give the GBS positive mothers. If mother is positive with this bacteria, so we can give the intrapartum antibiotics. So there is another organism also that causing the meningitis. So on that organism, that is known as Escherichia coli. It is Q1 strain. Moving on, morphology